So today I'm going to tell you about something called a foreign body. What on earth are foreign bodies? Well, they're a very common problem, and there's two types basically. The first thing is the definition of a foreign body, and that is an object that's alien to the animal's body. So when it comes to dogs, the first type would be something like a grass seed, might go between the dog's toes or into the back of the throat, or even a grass seed in the eye, or a bit of glass, or anything that shouldn't be in the body that is in the body. That's a foreign body, and these little ones causing irritation are one very common type. But the second common type, which is probably the one that most people have heard about, is a foreign body in the digestive tract. And the classic thing would be a dog might swallow a rubber ball, it gets stuck in the stomach, and has to be removed. So today I'm going to talk to you about those type of foreign bodies, digestive tract foreign bodies. The classic thing from an owner's perspective is that your dog starts to vomit, and it's quite common for dogs to vomit once or twice and then they get better again. But with a foreign body, what happens is a dog vomits once, twice, 3 times, 4 times, 5 times, 6 times. The next day you fasted them, they're still vomiting, and you know there's something serious going on. And often there are other signs as well, like they might become very dull in themselves, and they might have a big thirst. They generally become quite clearly unwell animals, and you go to the vet. So those are the signs of a foreign body. What kind of things can cause foreign bodies? I've already mentioned a rubber ball. Another example would be stones. Some dogs like playing with stones and they sometimes swallow them and they can get stuck in the stomach and intestines. There are some objects that are bizarre things that get stuck more frequently than you expect. An example would include a baby soother. That, you know, those sort of soft things that rubbery things, and because they shrink down when they get squashed, a dog can swallow them easily, but then they swell up in the intestines and then they get stuck. Another one would be things like peach stones. The rough edge of the peach stone means they get stuck in the intestines very easily. And another one would be a corn on the cob. Dogs like chewing corns on the cob, and the sort of serrated edges mean that they get lodged very easily in the digestive tract. So these things are very common. When you look at the population of dogs that are affected by foreign bodies, you'll see that there's a big peak in the early years of life. So as a vet, if I see a vomiting dog that's aged between, let's say, 3 months and 3 years, foreign bodies are way up on the list of possibilities. Whereas if I see a dog that's vomiting that's aged between 8 years and 13 years, it's far less likely to be a foreign body. Basically, I think what happens is dogs learn what they can eat and safely eat, and what doesn't work. So that's why the problem is much greater in younger animals. It's one of those situations where veterinary treatment is really essential. And as a vet, when I see a dog that's vomiting, one of the very first things I would do is to palpate the abdomen. That means holding the abdomen and squeezing like this, sometimes with 2 hands like this. And by doing that, you can actually feel the intestines slipping through your fingers, and if there's a foreign body there, you can often feel a hard lump, like a little stone or a peach stone or a rubber ball. You can actually feel it. You can't always feel it though, because sometimes dogs tense up when you can't feel things properly, or sometimes it's up in the stomach under the rib cage where you can't feel either. So X-rays are the next thing you normally do, and some objects like stones and rubber balls show up really, really clearly on X-rays. One X-ray you can see there it is, that's the problem. Other times the object doesn't show up so clearly. Not everything does show up on X-rays. So for example, a corn on the cob is almost invisible on an X-ray. So you then look at the different gas patterns on the X-ray and you try to work out what that tells you. If there's an obstruction there, there's lots of gas, and you can then say, yes, that looks very much like that's what's going on. And in some cases you have to go on and do ultrasound. Ultrasound is often a finer way of judging whether there's an obstruction there. Once you're pretty sure there's an obstruction, the only way to fix these problems is surgery. So what you do is you do an operation, cut down the midline of the dog, open them up, pull out the intestines and the stomach, find out where the obstruction is, and basically you just cut into the intestine, remove the obstruction and sew the intestine up. As you can understand, it's a major surgery. There is a mortality rate that is quite risky, But most dogs, once the foreign body is removed successfully, they go on to make a very, very good recovery. The only downside is that dogs that have done this once are a bit prone to doing it again. And I know some dogs that have had 3 or 4 surgeries because they just like chewing things and swallowing them. And so those dogs, their owners have to be very, very careful what they leave around the house. And when the dog's outside, sometimes it needs to wear a muzzle. So there you go. That's a quick rundown on the phenomenon of foreign bodies.